Today we're going to be talking about MAT. Logan, what does MAT stand for?
Medication assisted, I guess treatment. I said therapy before we were recording. I've worked in this space for a little bit. I worked at an addiction center before medical school, but I'm really excited to revisit this topic this evening. If you're just tuning in for the first time, I actually encourage you to listen to one of our previous episodes where Dr. Chun did a fantastic job kind of outlining the history of the opioid epidemic. And this is kind of part two.
Part two, yeah, because that's a conversation that needs an extensive amount of discussion,
Right.
given the scope of how really serious the opioid epidemic has gotten in terms of the mountain deaths. We actually surpassed 100,000 deaths per year from drug overdoses, and a majority of those are due to opioids, mostly fentanyl. But I posed that question to you, MAT, what does that stand for? Because I actually was trying to trick you into something. Yeah, so...
Did I get tricked?
Yeah, you did. I gotcha.
Nice.
So MAT, medication for addiction treatment. You're apparently not supposed to say medication-assisted treatment anymore.
Oh,
Did you hear about that?
I don't know, man. I can't keep up with these PC word changes in the world of medicine.
It's 2023. It's the cultural zeitgeist, right? We're always looking to modify our language, trying not to offend people. And I guess this is just par for the course.
Right.
Yeah, so it's bizarre. But I guess it is what it is.
And let's just pause on that and talk about that real quick. So I know a lot of people who live with alcohol use disorder, opioid use disorder. And it's kind of funny to me that we are arguing not me and you aren't arguing, but it seems like the world of medicine and the culture about semantics, how people want to be perceived. And yes, certainly I understand some people get very offended by the word alcoholic. But guess what? Some people also identify as an alcoholic. Maybe they're communities of, or members, of Alcoholics Anonymous. And that's how that term, that use of the word is meaningful to them and maybe is allowing them to motivate themselves to take care of themselves. And I remember I've literally talked to patients and said alcohol use disorder, and they're like, what the hell is that? They're like, do I have that? It's like, what are you talking about, doctor? So I think it's really funny. Like, we argue all these things. Does it really have that much meaningful impact on the patient? Like, I don't know.
That's the question, right? Here, I'm going to show you this little chart that was passed out. And this is where the term medication-assisted treatment is supposed to be avoided. And instead, we're supposed to use medication for addiction treatment. So take a look at some of the words, especially pay attention to that top line right there. It's exactly what you said. And I noticed that you paused before you said alcoholic or addict, because apparently those are also terms you're supposed to avoid. And I find myself asking, like, who's coming up with these things? Is there some kind of data that says if we use the word addict, if we use the word alcoholic, this leads to adverse outcomes for patients? Or is this par for course of 2023, the culture that we have of sensitivity, of being careful, or sometimes to a fault, being overly careful with our words, that, some group of academics are sitting in their ivory towers and coming up with things that are not appropriate. But in reality, like, if you just imagine an AA meeting, right? That's literally how you introduce yourself. You stand up, you say, hey, I'm June and I'm an alcoholic. So I really wonder if real patients, people that are actually suffering with substance use disorders, have actually been polled and had their input in coming up with a list like this, these terms that we can't use anymore. Because this kind of reminds me of, like, we talked about this a few weeks ago off air, the thing about Latinx, the term Latinx.
Oh, God.
So yeah, that's a term, right? For those of you who are
a
unfamiliar
term created
with it.
by white people. Let's be real.
Exactly. And
when
what was
my
the
wife
reason?
is of Mexican descent,
Right.
and she laughs so hard when she ever hears the term Latinx.
Exactly.
She's like, I'm a Latina. That's in my language. It's not even. It's more to me than just culture. That's how the language works. All of a sudden, if I'm, like Latinx, people are gonna be like, your Spanish is also terrible too.
Exactly. So a term that was invented because the gender language was deemed kind of, what should I say? Deemed a little bit provocative to a certain subject of people in our society, and thus the term Latinx. But when you actually ask people of actual Latin descent, a majority of them hate it and they think it's silly.
And that's what you showed me that chart. And if you could maybe read aloud some of the things from that chart, but I think we'll also post it.
Yeah, I'll put it
in
on the screen.
The show notes
they'll be
and
able
stuff
to read
too. But
along
it's
with
like,
us.
do we have to always change the language radically if one person offended? Is it like, how do we change these things? Is it even the majority? Like, sure, maybe are these terms medication assisted treatment offensive to 5% of the people who choose to engage with Suboxone or methadone or other treatment. I was also laughing at there. It said opioid replacement therapy versus, oh no, it's an opioid agonist therapy. It's like, what? That's
Imagine telling a patient that they'll just look at you like, what are you talking about?
Wait, so is this a different medicine? No, it's the exact same thing.
Yeah.
But gosh, I mean, I just get frustrated because I feel like we have such greater problems in the world of medicine and healthcare than arguing necessarily always the terms and language that's least offensive. I think it's important. I'm not saying it's not important at all, but I think sometimes we get lost in the details and get away from the big picture.